This section is on prevention. Good oral hygiene is essential for prevention of oral diseases. Both tooth decay and gum disease can both be prevented or reduced by regular toothbrushing with fluoride toothpaste. The following advice is from Delivering Better Oral Health, an evidence-based toolkit for prevention. The advice in this section applies to everyone and not just residents. The physical removal of plaque and the action of fluoride in toothpaste helps to prevent dental disease. It is the fluoride that is important to prevent and control tooth decay, and the physical removal of plaque that is important to control gum disease. For residents who have their own teeth, the following will help to maximize the preventive action of toothbrushing. Brush the resident's teeth at least twice a day with fluoride toothpaste containing at least 1350 to 1500 parts per million fluoride. Brush the resident's teeth last thing at night so that the fluoride continues to protect the teeth whilst asleep, and also on at least one other occasion. Brush all surfaces of each tooth carefully and the gum line to remove plaque and food. Ask the resident to spit out after brushing, but do not rinse, as this will reduce the effectiveness of the fluoride. Mouthwash can be used at a separate time to toothbrushing, as long as the resident will not swallow it. Ideally, you should clean between the resident's teeth using interdental brushes or floss, but this may be difficult to do in someone else's mouth. Use the resident's choice of toothbrush, either manual or an electric-powered one. For manual toothbrushes, use a small-headed toothbrush. Remember that toothbrushes should be replaced every 3 months or sooner if required, for example when the bristles become splayed. Use a pea-sized amount of toothpaste. Not all toothpastes contain the right amount of fluoride, so it's important to check the packet. Higher concentration of fluoride in toothpaste leads to better control of tooth decay. The dentist may prescribe high fluoride toothpaste for residents at higher risk of tooth decay, and these are used in the same way as other toothpastes. These toothpastes are not available to buy over the counter. Unflavoured, low-foaming toothpaste may be useful if the mouth is dry, sore, or the resident has swallowing difficulties. Section 5 includes more information on useful products. Also see the toolkit for further information. Looking after the mouth supports nutrition and hydration. Retaining healthy, functioning natural teeth is important, as it will help to maintain the ability to chew a healthy and varied diet. It also helps with communication and socializing, and with dignity and self-confidence. Diet plays an important role in the prevention of tooth decay. If possible, encourage residents to reduce the amount and number of times foods and drinks that contain free sugars are consumed. Ideally, consume sugary foods and drinks only at meal times, as this will reduce the amount of times teeth are exposed to sugar, which will help with tooth decay. This may not be possible, as residents may have a high sugar intake due to liquid medications containing sugar, or food supplements such as Fortisip or Ensure. In these cases, good oral hygiene is even more important. Try tooth-friendly snacks, savoury foods, or fresh fruit instead of biscuits, cakes, and sweets. If possible, residents should avoid sugary foods and drinks just before bedtime, as this can increase the risk of tooth decay, as the saliva flow in the mouth slows down when you're asleep. The current best practice advice for snacks and drinks in relation to oral health is about reducing the amount and number of times you have foods and drinks that contain free sugars, and about avoiding these just before bedtime. This may not be appropriate for a number of care home residents. A high proportion of residents are likely to be nutritionally vulnerable and at increased risk of dehydration. It is therefore important that oral health advice is given with a proper understanding of the dietary needs and risks of this group. Inappropriate advice could seriously compromise older people's hydration, nutrition, and social enjoyment. A holistic approach is required, taking into account the residents' personal preferences, any medical conditions they may have, advice from a dietitian or other professionals relating to their overall health and well-being, their risk of dehydration, and overall nutritional status. Malnutrition can delay recovery from illness and can predispose the person to further disease. When not enough calories are consumed through a resident's diet, then additional measures may be taken to increase calories. This could be through nutritional supplements. For people with their own teeth, this will give them a higher risk of developing tooth decay. This is because these often contain high quantities of sugar and are frequently consumed by sipping them throughout the day. It is essential that professional nutritional advice is followed, but the potentially harmful effects on the teeth should be minimized by following a thorough oral hygiene routine. It is important that residents have a choice of foods and drinks, and that sweetened foods and drinks are not the most accessible option. Information should be available where possible to assist residents and the staff caring for them in making healthy choices. This includes clear labelling on sugar content and highlighting tooth-friendly options. Many of the drinks that care home residents need or prefer contain high levels of sugar. This includes nutritional supplement drinks, fruit smoothies and fruit juice, squash, tea and coffee with added sugar, and malted drinks. Additional mouth care is necessary for residents who choose or need to drink these to maintain their nutrition and hydration levels, and it may be helpful to get input from the resident's dental team, and this may include the prescription of high-dose fluoride toothpaste by the dentist. In summary, use the resident's choice of toothbrush, either manual or electric powered. If using a manual toothbrush, use one with a small head and medium texture bristles. Brush the resident's teeth twice a day, last thing at night and on at least one other occasion during the day, using a fluoride toothpaste containing at least 1350 to 1500 parts per million fluoride. Ask the resident to spit the toothpaste out after brushing and do not rinse. If a resident uses a mouthwash, use this at a different time to toothbrushing. Have sugary foods and drinks less often if possible. See a member of the dental team regularly and as often as they recommend.